Welcome to THA's final CAP recap for the 2023 session of the Texas Legislature. They're the two Latin words everyone involved with the turbulent and explosive session of the legislature longed to hear: sine die, signaling ultimate adjournment. And Monday, when the 2023 regular session finally reached sine die, hospitals were still alive, after months of hospital advocates beating back threats to their viability across Texas, while simultaneously working to promote a better healthcare environment. THA and its members accomplished all that during possibly the most challenging session hospitals have faced in recent memory, scoring wins that represented both progress and avoidance of dangerous detours and regression for access to care. Hospitals tallied successes in their push to rebuild the state's workforce, improve behavioral health care, and fund programs and services through the state budget. Here's a high-level look back at how the entire session and its final week unfolded for hospitals. 1 year of postpartum Medicaid coverage for new mothers, a high priority for THA, other groups, and powerful lawmakers, finally got through the legislature in this final week and headed to Governor Greg Abbott's desk. A conference committee resolved the introduction of a late amendment to House Bill 12 by Representative Tony Rose, which would represent a vast improvement on the current 2-month coverage requirement. Governor Abbott previously expressed support for 1 year of postpartum Medicaid coverage. If he signs the bill, the coverage extension would then need to earn approval from the federal government, which 2 years ago declined to sign off on Texas extending postpartum coverage from 2 months to 6 months. But for now, the advancement of HB 12 into state law would be a hugely impactful win for THA. The final week also saw the House and Senate agree on a final version of Senate Bill 25 by Senator Lois Kolkhorst, a wide-ranging post-secondary nursing education bill that increases state support for nursing scholarships and offers new loan repayment assistance for nurses and nursing faculty. Like HB 12, that bill now sits with the governor. Also in the final days, Governor Abbott put his pen to the text of a high THA priority, House Bill 1890 by Representative J.C. Jatan, which allows Texas hospitals to continue the highly successful federal hospital-at-home program that helped contain surge capacity during COVID-19. Governor Abbott signed the bill last Saturday, adding HB 1890 to a list of legislative wins that began piling up in the final couple of weeks. Several other THA high-priority victories had already been signed into law. Senate Bill 240 by Senator Donna Campbell and House sponsor Representative Donna Howard, which requires all healthcare facilities to implement a workplace violence prevention policy, earned the governor's signature. SB 240 also requires facilities to maintain a workplace violence committee, provide workplace violence training at least annually, and prohibits retaliation or discipline for reporting a violent incident in good faith. Also on the workplace safety front, Senate Bill 840 by Senator Royce West, which enhances the penalty for assaulting a hospital worker to a third-degree felony, was also signed by Governor Abbott. The governor also approved House Bill 49 by Representative Stephanie Klick, which contains THA negotiated language to make final hospital investigation reports and outcomes public, as well as the number of times the state has investigated a given hospital. But perhaps the most intensively realized fruit of THA's labor during this session was simply keeping hospitals open for business, by stopping legislation that would have been disastrous for facilities all over the state. THA repeatedly called on its members to sound off to lawmakers about measures that would have instituted dangerous government rate setting. As filed, House Bill 1692 by Representative James Frank and Senate Bill 1275 by Senator Kelly Hancock, both ultimately defeated by THA advocacy, would have banned hospital outpatient payments. And Representative Frank's House Bill 633, as filed, would have capped hospitals' payments at the lowest contracted commercial rate they had with any health plan for services provided outside of insurance. A point of order on the House floor resulted in House Bill 633's death. THA's all-hands-on-deck approach to stop these harmful measures, which required participation from both engaged members and conscientious lawmakers, averted what could have been widespread disaster. One major measure that did pass over THA's opposition was Senate Bill 490 by Senator Brian Hughes, which requires hospitals and other facilities to provide itemized bills to patients within 30 days of receiving payment from a third party and before collecting payment after care is provided. Governor Abbott signed that bill into law on Monday. Along with major victories and standalone legislation, hospitals had plenty to cheer about in the state's final budget for 2024 to 25 as well. Lawmakers who started the session with a record surplus of more than $30 billion meted out key funding for Medicaid, behavioral health, workforce, and other THA priorities. A few of the biggest positives for hospitals included the following: full funding for Medicaid, nearly $81 billion over the biennium, with full trauma and safety net add-on payment funding within that amount. A tripling of the Medicaid Rural Labor and Delivery add-on payment from $500 to $1,500. The addition of nearly 200 new inpatient psychiatric behavioral health beds. A dramatic funding bump for the loan repayment program for mental health professionals, going from about $2 million in the current biennium to $28 million in the next one. A jump from $19 million in the current budget's allotment for the Nursing Shortage Reduction Fund to nearly $47 million for 2024 to 25, and $25 million added to the base budget for nursing scholarships. One source of disappointment for THA in the budget was the absence of a rider directing the state to pursue a waiver from the Institutions of Mental Disease, or IMD, exclusion, a 15-day limit on most adult inpatient behavioral health stays in Medicaid. For a more in-depth look back at how THA and its member hospitals fared in this session, stay tuned for THA's end-of-session report, scheduled to be released in mid-June at www.tha.org. Also on the website, you can listen now to the recording of THA's end-of-session member call held on May 25th, just before Sine Die.